The medical information included in this podcast is provided as an educational resource only. Please consult your healthcare provider before making any healthcare decisions.
And you have to remember, it's your data as well. It's not just the physician's data. It's your data. So it's you, it's how you're doing. And you need to know that so you can manage your care.
Hi, everyone. Welcome back to the Fabrycast. Our episode today is called Behind the Lab Coat, Fabry Tests and Why They're So Important. If you're part of the Fabry community, you're aware of the many Fabry tests patients have. The frequency and specific tests may vary from patient to patient based on age, symptoms, and disease progression, but we're going to hear today about some of the more common routine Fabry tests and what your team is looking for and why these tests are so important. One of the intentions of this podcast is to empower patients. When we know more, we make better decisions. And if you're a patient listening, I know you can relate to the burden that these frequent tests can sometimes bring. I don't think it's anyone's favorite part of the day when they walk in to get their cardiac MRI or their brain MRI, or when you have your 2-week Holter monitor on. And I think that's okay. It's okay to not like this part because it is a lot and it's time consuming. And then waiting for the results can bring some anxiety and fear of the unknown. And that's a lot too. But the part to remember is that these tests are so crucial for early detection, and we get to actively participate in managing our disease. So we're going to dive in and learn why it's so important to keep up to date with our labs and tests. And joining me today is Kaye LeMoine. Kaye has been working with Fabry patients for 25 years. She lives in Nova Scotia, and her current role is the National Program Manager for the CFDI. So welcome, Kaye.
Thank you, Julia. Really happy to be here.
Thank you. We're happy to have you on. And I guess my first question is, what is the CFDI? And what is your role in working with Fabry patients?
Sure. So I am the National Program Manager for the Canadian Fabry Disease Initiative, which is the largest investigator study in the world on Fabry disease. So we've been operating since 2007. We try and follow every Fabry patient in Canada that has a confirmed diagnosis. And my role is I'm sort of the overall manager for the study for the country. So I look after ensuring that each site has its ethics approval, that patients are enrolled that should be enrolled, and data, we're getting good data in so that we can make decisions about care for all patients, not just in Canada, but also it can influence across the world, across the globe, how care for Fabry patients is evolving.
And you are also in the clinic setting too, right? You're working and you're seeing patients.
Yes. So we have about 105 patients here in Nova Scotia that we follow. I also manage the clinic, so booking patients. I do follow a few patients, not many anymore. But I'm also here as an advisor for younger staff that are newer to the Fabry world and do training for some newer coordinators and newer Fabry nurses. Everything from infusions to care of the Fabry patient and stuff like that.
And you're also one of the medical advisors for the Canadian Fabry Association. And
yes, I am.
And we've had you, when we were going through Canada, we had our patient empowerment meetings. You did a lovely talk on helping patients understand why there are so many tests and what our healthcare teams are looking for during these tests. And I think what was so important about that is when patients are listening to this, I think that there's a bit of a feeling of, we can let go of some of that fear when we understand what's going on. So will you take us through the tests that we have and why we're getting them?
Sure, no problem. And we all realize it's a lot of tests to ask patients to do. Sometimes it's done in clinics. Each test is a little bit different. Each clinic's a little bit different, how it's set up and what we do. So I do realize it can be quite cumbersome for patients to have all this testing done And it seems you probably feel like as a patient, you just got through one batch of tests. You're going back to see your Fabry treating physician and you have to get it repeated again. And that's a really big burden.
Totally.
I will say it is a burden. It's a brutal burden at times for patients, but we can't tell how you're doing by looking at you physically. So we need to see what's happening on the inside of you. And that's why we order all these tests. So starting from blood work right down to brain MRI and that stuff. So we do blood work because we want to see what your serum creatinine is, what your lipids are. So we want to see what your serum creatinine is because we want to understand what your renal function is. We do urine tests on you because we want to know how much protein you're spilling in your urine. We want to do fasting lipids or a lipid test because we want to know what your cholesterol is. Because if your cholesterol is high, that causes damage to the vessels. Fabry disease also causes damage to the vessels. So if you have a high cholesterol and a disease that causes those damage, they're going to conflict and they're going to make a bigger impact on the vessels. So that's sort of some of the stuff we want to look at. The other stuff we'll look at is your hemoglobin. Sometimes patients will have low hemoglobin that have Fabry disease, so we want to see if there's anything we can do to help boost your hemoglobin, simple as iron supplements, or it could be a little bit more involved. We also want to look at doing an EKG on you. One of the reasons we do an EKG is we want to see if there's any rhythm defects or you have a low pulse. Sometimes you can't pick it up from just trying to get somebody's heart rate by palpation, but just by doing this, touching your fingers to your wrist. Sometimes we need it done on the machine. It'll pick up more intricate details. The other thing we're going to look at is a Holter monitor. Some people do a Holter monitor for 24 days. Some do it for 2 weeks. Those Holter monitors are really important because sometimes at night, Fabry patients heart rate can really dip at night when they sleep, and we want to track that. And that's one way to track it is doing the Holter monitor. The other things we may order is an echocardiogram or a cardiac MRI, and that's based on where you sit in the country. So some parts of the country have a better ability to be able to order a cardiac MRI versus an echocardiogram. The wait list isn't as long. So for here in Nova Scotia, we're able to order an echocardiogram quicker than we can a cardiac MRI. In Alberta, it's easier for them to order a cardiac MRI than an echo. So we look similar stuff in both tests, but some stuff are slightly different. So for both a cardiac MRI and an echocardiogram, we're looking at the septal wall thickness, the posterior wall thickness, the size of your left ventricle, all that stuff. And then the other thing we're looking at in a cardiac MRI would be also if there's what they call gadolinium enhancement or early fibrosis in the septal walls of the left ventricle. So early fibrosis in the left ventricle on a cardiac MRI is an early indication for treatment. So this stuff, the cardiac testing, want to make sure that your heart's functioning well, that you're doing well, you're not having any of the symptoms of left ventricle hypertrophy, your heart's not getting bigger. So that's some of the stuff we're looking at when we do a lot of the cardiac testing.
Now, for the cardiac MRI, it was brought to our attention at our women's retreat. Someone was mentioning that when they had the gadolinium, that they felt nauseous, and that was a side effect from having it. So then they asked if they could do it without the gadolinium, but not realizing that the importance of that gadolinium to be able to see what's taking place in the heart was you need to have the gadolinium. And it's so important. So maybe would you talk about that a little bit so then we know that that's such a...
Sure.
Yeah.
So the gadolinium is really important because it picks up early fibrosis that would not be seen without using the gadolinium. That fibrosis doesn't get seen on the images that are done from the cardiac MRI. With it is an injection of small dose of gadolinium. That small dose of gadolinium picks up that fibrosis, and you may be able to start treatment 2, 3, up to 5 years early before your left ventricle starts to show thickness or starts to show that it's increasing in the measurements, both in the posterior and the septal wall.
Yeah.
Does that make sense?
Yeah, it does make sense. And I think it also brings to light that if you have any side effects from any of the tests that you're doing, this is it's you, your physician and your team is there to help you and, figure that out so we can get the best results. And it really is a team, it really is a partnership between your healthcare professionals and yourself.
Absolutely. If you find that you're allergic to the EKG leads or the Holter leads, you can let your team know. And when we're doing up our recs to send in for you, we can write something as simple as, please use paper leads versus the severe adhesive. Because some of we've had ladies that have complained that, when they rub your chest with a little bit, it's like a little gritty sandpaper. You can break down and you can get like a little, it's not eczema, but it's like a little bumps in the skin and that stuff. It's a little allergic reaction to that. So if they use the paper leads, it's not as bad and you don't react as much.
Yeah. And it seems these are small things, in the grand scheme, these are really small things, but they really do go a long way because it helps. Oh, it helps you if you have to do this every year or every 6 months or, it's these things that can sometimes maybe even in our minds push that appointment a little bit, saying like, oh, I'm kind of dreading this one again. I don't want to do this right now.
Absolutely.
And you might push it a little bit. You might push it a couple months because, there's some discomfort that comes with some of this. And some of that is going to be there. But if there's things that we can do that will help make it easier, we got to do those things to make
Absolutely.
it easier.
That makes it so much easier.
Yeah.
So just let us know.
Yeah. And also, so globally, how was it decided that these are the tests that Fabry patients should do?
So there was an original article in one of the medical journals by Dr. Christine Ng, and she was, I think, at Baylor University down in Texas, and she wrote kind of the seminal, quote unquote, paper that just kind of listed what should be done and how frequently it should sort of be done on an annual basis. And it's been quoted a fair bit in the literature for that stuff. The other one is Dr. Ortiz has kind of taken that paper and updated again, just because, 2006, 2024, big time difference. And there's been a lot of progress in Fabry disease and what we do. So Dr. Ortiz took it upon himself and revamped that paper, which is just terrific because there's been so many changes to all the testing that we do.
Terrific. And if patients want to look these papers up, we'll put them in the show notes. And so you can click on the show notes and you can see that, and you can kind of learn a little bit more about it. And I think there's also, is it Dr. Hopkin that did one for pediatrics as well? So it's Ortiz.
I think so. Yeah.
Okay.
Yeah, I think Dr. Hopkin in the U.S. has done a paper as well on kids, which is really lacking in Canada. And just to get the standards done to do what to do with kids and that stuff. I don't recall there's many other papers like that, but that is a really great paper.
Okay, so we'll
just so people have an understanding.
Yeah, that's perfect. When you have the opportunity to be in clinic and you see Fabry patients, and I'm sure you've seen it many times when there's a patient in front of you and they're feeling really, you make sense that they're maybe not going to go through all the tests that you're suggesting they do. If anyone's listening and they're having these kind of feelings or doubts or thoughts, what would you suggest? What would you tell us?
We realize we're asking a lot from you to get all these testing done. Your cardiac tests are really important to have done. Your brain MRI is really important to have done, or your CT of your head is really important because you can pick up on the brain MRI or CT of your head that you've had a stroke in your sleep and you may not realize it. You may get up the next day and think, oh, I got a bit of a headache. I just feel a little off. Maybe I'm coming down with the flu. But in reality, you might have had a little small stroke in your sleep and you don't really realize it. You may not have any residual effects from that stroke, but it's always good to have that. The other thing is your blood work's really good to have done. And even that spot urine test that we do in clinic to measure your proteinuria, that's great to have done. So those tests are really important to get done. We do realize it. I know everybody complains about having questionnaires done. That's probably, I think the questionnaires are even worse than the testing because the testing, they're like, oh yeah, that's common. But when we sit and come up with those questionnaires and you're thinking, it's the same stuff, I'm going to repeat myself from last time.
Right.
You just never know when you really read the questions, like maybe I'm not feeling as good as I think I am. And maybe if I fill this questionnaire out the way I'm really feeling and not just saying, yeah, there's no difference, that we may have something for you. Like your pain may be worse. We don't realize it because you're not really verbalizing it well. But when we look at your pain questionnaires, we may see that your pain's getting worse and that we may be able to say, look, hey, looks like your pain's worse. Do we need to talk about how your medication's working for you? Do we need to look at another plan for you for your pain medication? So it can be as simple as that stuff when you're looking
Absolutely.
at that.
Absolutely. And I think you bring up a really good point about those questionnaires because it covers a lot of head to toe and it covers the things that we don't maybe have time or maybe don't bring up in discussions with our physician. And those are the things that are sometimes maybe missed or just missed because we don't have enough time. But I think in those, we may be able to help things like, how are you sleeping? Kaye and I, we were both just at the World Symposium. And one of the important topics there was fatigue in Fabry disease, and especially in females. And this isn't something that's maybe always brought to light at your visit. So taking the time to fill out that questionnaire and saying, you know what, I am experiencing fatigue, and maybe giving it a number, and learning about it, and then that maybe will prompt the discussion and learn collectively what's happening in the Fabry space. So by filling that out, you're filling it out, but also thinking about what that means for the greater picture, which is then you have more researchers and more eyes and more attention to this issue that maybe not only you are having, but a lot of people are having.
Absolutely. Fatigue is huge. It impacts so much, just like sleep impacts so much. You don't sleep well, you get up, you're tired the next day, you're fatigued. It's just a vicious cycle. So yeah, we need to know that. So there may be things we can do to help you moderate it, not to get over it, because it's really doesn't go away, but we can maybe figure out something to do to help you cope with it.
Yeah. I think one of the last things I kind of want to mention is that we get to be part of this also. As a patient, I think there's an ownership there of, knowing your numbers and knowing your trends and knowing that, however you want to keep it tracked on your phone is probably the easiest location. So I think years ago we used to give a binder and we used to say, bring your binder in. And thankfully we don't have to bring a whole, hollow binder with us anymore. But what we do have is our phone, even if it's as simple as, opening up your notes and just writing, what your levels are, what your numbers are. And then you have that. And it can just take a couple of seconds, but there's also some really great apps now available. One is called My Fabry app. You can find it on, where you search in for your apps, My Fabry app. And there's a lot of other ones that are being created to just as symptom trackers. And you can bring that to your physician too. And so you don't forget anything. And you can just, I forget that there's like a quote, but it's pretty much saying, data works when you have one point to measure the next point. So, you have a baseline and then you're measuring that from one point to the next. That's how you measure a trend to see. So I think it's actually very interesting to be able to be in charge of your information and to know your information, because that gives you your power back. Having a rare disease, you don't always feel like you have a lot of control in when your symptoms happen, and maybe you don't want them to happen, of course. But I think being able to look at your symptoms and track your numbers, and that can sometimes take some of the fear away when you're going for your EKG and wondering what they're looking for. Now, if you know what they're looking for, you can be part of that process too.
And you have to remember, it's your data as well. It's not just the physician's data. It's your data. So it's how you're doing. And you need to know that so you can manage your care along. It's a joint decision between you and your Fabry treater. So in order to do this, you do need to go for the testing. But then when the results come back, when you're at your appointment, you need to say, okay, how was my echo compared to last year? Was it better? Was it worse? Is it the same? How was my cardiac MRI? Is it better? Is it worse? Is it the same? What's my EGFR? And then you may want to ask that question. What do those numbers mean? if they talk about numbers. You should, don't be afraid to ask the hard questions. You need to do that.
Great advice. Do you have, for every Fabry patient listening, do you have one thing that you'd like us to know?
Yes, I do. I guess it's my tip is watch your salt intake and read your labels on food. Salt is so prevalent in food that we don't even realize how much salt's used in food altogether. Processed food, any kind of food. So read your labels, watch your salt content. High salt content can impact your kidney function and your heart function. So you really want to, with Fabry disease, can impact both. We all know Fabry patients, cardiac, renal function, those two are hugely impacted. So we want to be able to limit your salt intake so that it can help to work with your kidney function, improve your kidney function, and help improve your heart function.
Wonderful. Great tip. And thank you for your time today. Thank you for all you do to be part of this community. A great conversation. And it's really given patients empowerment to learn about what's going on in the body, what we're looking for, and why it's so important to go for these tests.
Thank you, Julia. It's been my pleasure. And it is my pleasure to look after Fabry patients.
Thank you so much for joining me on today's episode and for being part of the RARE community. You can follow the Canadian Fabry Association on Instagram, Facebook, LinkedIn, and visit us on our website, fabrycanada.com. And of course, if you haven't yet, subscribe to this podcast. We'll see you next time. Keep listening, keep learning, and be rare, be you.